हरि ओम. नमस्कार सर्वांना, उपस्थित सर्वांना माझा नमस्कार. परमपूज्य गुरुदेवांना माझा नमस्कार. मी श्री अंबिका योग कुटीरची विद्यार्थिनी राहिली आहे. सुर्वे काका आणि काकू ह्यांच्या मार्गदर्शनाखाली मी योग शिकली आहे. त्यामुळे आजचा दिवस माझ्यासाठी फार खास आहे. अ, परमपूज्य निकम गुरुजींना माझा नमस्कार आणि थँक यू टू ऑल द ऑर्गनायझर्स फॉर इन्व्हायटिंग मी टू टॉक ऑन important topics on chronic pain and mental health and the intersection. So let's start by looking at what is pain. Are you able to see my slides?
Hello. Ma'am, you'll have to stop your
Hello.
presenting. We'll present your slides from here. Is that okay?
Okay,
Yeah?
sure.
Okay. Okay. Thanks.
Yeah, that should be fine. Thank you. Can you please let me know when I should start talking?
Hello. Ma'am, can you see your
Yes.
presentation on the screen?
No. Now I can. I can see
Yeah.
multiple
Yeah.
windows.
So you may proceed now. Thank you.
Okay, thank you. So, I wanted to start with understanding what is pain. The International Association for Study of Pain defines pain as an unpleasant sensory and emotional experience that is associated with actual or potential tissue damage. मी खास करून इथे दोन वर्ड्सना अंडरलाईन केलं आहे. एक म्हणजे एक्सपिरियन्स आणि दुसरा म्हणजे ॲक्चुअल ऑर पोटेन्शियल टिश्यू डॅमेज. ते ह्यासाठी की ह्या डेफिनिशनमुळे काय झालं की there is a greater acceptance that pain is a subjective experience. So, what that means is each one of us will experience pain differently. And also, the second bit is that it can occur in presence of actual tissue damage or potential. म्हणजे काय की जर तुम्हाला लागलं, तुमच्याला दुखापत झाली आणि वी कॅन सी द वुंड, तेव्हा तुम्हाला जे पेन होतं तेही व्हॅलिडेटेड आहे. व्हेरएज समटाईम्स एक इंजुरी होते, ती हील होते आणि तरीही पेशंट्सना खूप जास्त वेदना होतात. तर दिस डेफिनेशन एक्सेप्टेड or gave validation that those patients who also report pain is true. It also helped to bring in experience of pain from children and elderly perspective as well. Now, when it comes to chronic pain, any pain that exists beyond 3 months is categorized as chronic pain. Broadly, it is categorized as primary chronic pain and secondary chronic pain. प्रायमरी क्रॉनिक पेनचं उदाहरण द्यायचं तर क्रॉनिक हेडेक्स जेव्हा सारखे हेडेक्स होतात, बट देर इज नो अंडरलाईन कॉज किंवा फिजिओलॉजी कळत नाही, त्या पेनला क्रॉनिक पेन म्हटलं जातं, प्रायमरी पेन. Whereas secondary pain is mostly something that is associated with an established condition such as osteoarthritis किंवा endometriosis. ह्या पेनना secondary pain म्हटलं जातं. Now the burden of pain, the third slide, please. So the burden of pain in our communities is enormous, so much so that 1 in 5 adults will live with chronic pain. What that means for us here, sitting in the auditorium, unfortunately, is that each one of us will come across chronic pain, either because we experience it or a loved one experiences it. त्यामुळे ही जी क्रॉनिक पेनची जी लाट आहे, त्यापासून कोणीही वाचणार नाही. Unfortunately, त्यामुळे we need to talk more about it. We need to create more awareness about it. And if we look at WHO data, what that shows is that the burden of chronic pain, it exceeds diabetes, heart disease, and cancer. So you can imagine what a big issue that is heading towards us. Anxiety and depression, which are two main mental health challenges, are common complications of chronic pain. Now, pain is always a subjective experience. If I want you to remember something from these two slides, is that pain is always subjective. No two people will experience pain in the same way. Each individual will experience pain in their biopsychosocial context, and we'll have a look at what does that mean. But pain also has three key features, which is sensory, that is pain intensity, how you feel when you experience pain. There is an affective feature, which means how you feel emotionally, what are your emotions around it, and cognitive, that is how does your brain process it, how does it impact your attention. So these are key features, and these are really important because we can then see how yoga can help us with that. The next slide, please. When we say that biopsychosocial context of pain, or every individual will experience pain in their own context, by biology we mean that it's your age, it's your gender, how inflammation is going on in your body, what are the physiological changes, is there arthritis, have you had surgery before. When we look at psychological aspects, we are looking at how is your emotion, how is your thought process, how is your mood. When we look at social, we are looking at how well is your family functioning, how connected you feel to the society. Next slide, please. But in in order to look at these things, I think there are four elements. So the four elements are biopsychosocial and spiritual. um, the fourth spiritual element is something that's come about from my research, which shows that people who experience chronic pain and mental health challenges are also trying to understand the greater purpose of life. What does it mean for them as an individual suffering through these conditions? They're looking for hope, they're looking for belonging. Next slide, please. So it brings us to the next aspect, which is mental health. Now, WHO defines mental health as a state of well being where an individual realizes their own potential, they can handle the normal stress of life, they can work productively, but also contribute back to the community. So this definition, आपण ह्या definition कडे बघितलं तर आपल्या लक्षात येईल की फक्त स्ट्रेस फील नाही करणं म्हणजे मेंटल हेल्थ नाही. तर you should feel supported enough in life to then live a meaningful life, live a fruitful life, and also give back to your community. So that nicely shows us how the biopsychosocial construct is really important. Mental health, as we all know, is a fundamental human right. Unfortunately, we have 1 billion people worldwide living with chronic mental health conditions, and that has increased because of the pandemic. It is a leading cause of disability as well as premature mortality. And again, pain is one of the common symptoms of anxiety for anxiety disorder. Now, people living with chronic pain are at twice the risk of mental health conditions. Next slide, please. So this particular graph I have added in just to emphasize the connectivity or the overlap between chronic pain and mental health. मी का ह्या दोन गोष्टींकडे एकत्रितपणे बघत आहे माझ्या कामातनं आणि माझ्या रिसर्चमधनं. त्याचं कारण हे आहे की सुरुवात होते तेव्हा पेन फील होतं, त्यातनं मग स्टिफनेस आहे, स्वेलिंग आहे, पुअर स्लीप आहे, उत्सुकता नाही वाटत, काही करावंसं नाही वाटत, मलेस आहे, लो मूड आहे, हाय स्ट्रेस आहे. पण ओव्हर अ पिरियड ऑफ टाईम, आणि हे सर्व एक विशियस सायकल फॉर्म होते. पण ओव्हर अ पिरियड ऑफ टाईम काय होतं की दॅट चेंजेस इंटू क्रॉनिक पेन. मग इट बिकम्स डिक्रीज्ड मोशन अँड function of a patient. It changes into isolation because people don't want to go out since they have so many challenges to move around, and they feel high level of stress, anxiety, and depression, which is clinically diagnosed. Intentionally, if you look at the right side of the figure, I have kept the arrows bidirectional. ते ह्याच्यासाठी की each of the presentation can not only make each other worse, but they can maintain itself. So it's really important की pain आणि mental health हे आपण एकत्रितपणे बघण्याची खूप आवश्यकता आहे. Next slide, please. So, what should the future encompass? When we talk about future, I think it's really important to bring in the biopsychosocial spiritual model and think about what will help you or what will help the people who experience one or both of these conditions. It is biologically मग आपली activity, nutrition, sleep आहे. Psychologically, to look at your mental health, you need to engage into meditation, mindfulness, yoga. When it comes to social, there is an important construct called as dyadic coping, and I'll speak about it in a while. Social connections. When it comes to spirituality, whatever healing practices appeal to you, whether it is reading a holy scripture like Gita or Bhagavad Gita, kiwa journaling, kiwa meditation, gratitude, praying, these are very important factors. But I want to emphasize here ki we look at these strategies, and we have had fantastic speakers from morning who have emphasized physiological mechanisms that go behind these strategies, but none of them work in isolation. म्हणजे असं नाहीये की तुम्ही जर योगा केलं तर तुमची फक्त मेंटल हेल्थ इम्प्रूव्ह होईल. योगामुळे तुमची फिजिकल हेल्थ पण खूप इम्प्रूव्ह होईल. If you have a normal food, if you have a non processed food, it will not only make you feel better in terms of physical health, but it will help your mental health as well. So, idealistically, individual management's kade baghna is selling the management plan shorthandedly. So, looking at the bigger picture is really important. Next slide, please. So, I wanted to briefly touch about the role of yoga in chronic pain and mental health. And a lot of the speakers have already covered this aspect. But just to name a few, we have heard that yoga helps in muscle relaxation and tension relief. What it does actually is that it increases your range of motion over a period of practice, and that helps in restoring some of your function and reduces your pain. But importantly, what it does is it challenges your brain to think about what I can do and what I can't do. Because a lot of time, chronic pain kiwa mental health conditions मध्ये there is a limitation on self belief that this is something that I can manage, this is something I can't do. So with the regular practice of yoga, it makes you more flexible in your attitude and your belief. Again, yoga emphasizes proper alignment that helps with structuring of your spine and also improves your muscle tone and flexibility and joints, reducing the intensity of flare-ups. Breathing, we have seen a lot about pranayam and deep breathing techniques that help with nervous systems and activation of parasympathetic nervous system, which gives you a sense of relaxation. Yoga has been documented to reduce inflammatory markers and alleviate pain. Next slide, please. And we have also heard people, speakers talk about neuroplasticity. In simple terms, मध्ये सांगायचं तर your brain is capable of adapting and change. And we all know that we are living examples of how we coped as kids versus now how we cope as adults. So तुमच्या ब्रेनमध्ये ही पॉवर आहे की तुम्ही अडॅप्ट होऊ शकता. आणि नेगेटिव्ह अडॅप्टेशन पण होतं. आपण बघतो की कधी-कधी खूप स्ट्रेस वाढला की हंचिंग ऑफ शोल्डर्स होतं आणि you don't work out, you don't socialize, you don't commit to anything that adds into you, but you commit to things that drains you. So basically neuroplasticity is that element where your yogic practices trains your brain to get more attached towards practices that add into you as a human being. So, yoga is very, very useful for enhancing your neuroplasticity. And so, likewise, we have heard that brain centers like hippocampus and the prefrontal cortex, which are two important things to for emotional regulation, but also decision making, are then enhanced. Stress reduction and cortisol regulation, not only through physical tension, but managing your psychological distress. There's mindfulness practice in yoga where it encourages us to focus on the present moment. So that brings down the stress hormone. And last but not least, that social connection and that support of belonging to a community which has a common goal of yogic practice and living a better life. That sense of community is really important, and yoga gives you that. Next slide, please. I've done a little bit of work understanding what can be done for CALD communities, which is cultural and linguistically diverse communities here in Australia. And what I see is the missing link is the cultural lens. A lot of times my work has taken me to US and Europe and in Australia, and I see that the global community is a very culturally rich community, but our healthcare system does not reflect that. When we talk about culture, people still believe that culture means the food you eat, the dress you wear, and the festivities. But inherently, what culture means is our belief system, our values, our practices that we as a society have learned for ages. And culture also forms the basis of how we view health as well as illness. त्यामुळे काय होतं की most of our cultural belief also dictates what we think of as health behavior and what we think of as illness behavior. त्यामुळे cultural lens is really the missing link. Next point, please. So, the key cultural barriers are stigma. There is still a lot of stigma around mental health uh, because mental health issues are considered as not being resilient enough. कि तुम्ही कणखर नाही आहात enough. But over repeated science has shown that mental health issues have very less to do with really how resilient you are, but it is more to do with all combined factors that affect you. So it needs to be looked at from a very बायोमेडिकल पर्स्पेक्टिव्ह हा स्टिग्मा रिड्यूस करणं खूप गरजेचं आहे आणि त्याच्यासाठी एक मेजर पाऊल हे आहे की आपण त्याविषयी जास्त चर्चा करणं ओपनली आणि नॉन जजमेंटली. लँग्वेज बॅरियर्स आहेत बाहेरच्या देशात राहणाऱ्या लोकांसाठी आणि ऑल्सो फिअर ऑफ डिस्क्लोजर कारण आपली माय देश सोडून इकडे आल्यानंतर देर आर रिस्ट्रिक्शन्स अराउंड एम्प्लॉयमेंट अँड वर्क अपॉर्च्युनिटीज सो पीपल डू नॉट टॉक ओपनली. नेक्स्ट स्लाइड प्लीज. So that's a solution, Manun. I'm developing a program which is an evidence-based digital well-being program. This program will be co-designed with the communities who need it, and it will be built in consultation with them. And culture will be an integral part of this program. Next point, please. So these are some of the structures that I'll be using to develop that program. In the interest of time, I won't go through all of it, but basically discussing with the community what is the significance of having certain conditions from a cultural perspective, what are the formal and informal methods that they employ to cope with this, how do they generally cope with life pressures, work, and family responsibilities. Next slide, please. And this program is called Cherish Cultivating Health Equity Through Respect, Inclusion, and Support for Health Disparities. The vision is that through this program, we not only heal but empower CALD communities and families to live meaningful lives globally. The program is first of its kind that will directly work to manage coexisting pain and mental health challenges. It will build a community of collaborators through provision of training, of resources, advocacy, and policy work. And the significance is that it will integrate the cultural context. Next slide, please. Before we came down this path, I did mention dyadic coping. So, Cherish will integrate some of these novel approaches. Now, dyadic coping, in a very simple term, is when two people share an intimate bond. As of now, the research is only looking at husband and wife and parent and child. So, two people who are in a very close relationship, and one of the member gets ill. The strategies, the coping strategies that they both employ as a unit is known as dyadic coping. And it is important because dyadic coping has repeatedly shown that it not only supports the patient, but it also supports family functioning and maintains relationship. Dyadic coping is also critical to minimize mental health challenges for the family. So we are going to integrate this aspect in Cherish. We have been very lucky and fortunate that my paper was selected as an editor's pick last year, and we received the Novel Idea Award at a international conference here in Australia. What we really need to do is the emphasis here is just for not focusing on individual but looking at what we can do to support communities and families thrive with debilitating conditions like chronic pain and mental health. And medicine, importantly, medicine should reflect what the society looks like. And I think this conversation should start with community members like yourself who are passionate about changing bringing a positive change in the society. So this is a very important area that needs to be discussed. I'm almost at the end of my presentation. What I really wanted to emphasize here is that yoga provides not just relief, but it also fosters a sense of empowerment to individuals by giving tools to manage debilitating conditions. This also yoga also provides autonomy for reclaiming control over both body and mind, offering a very transformative approach of living with chronic conditions. It could be anything, it could not just be limited to chronic pain and mental health. For today's sessions, you have heard numerous speakers talk about the benefits of yoga. What I would really urge all of you to do is to have like a bank account of the asanas that help you, and use your inherent gut feeling to find those things that you gravitate towards when it's a good day or it's a bad day. आणि सर्वांनाच असतं ते की कधी कधी यू फील रिअली गुड, कधी कधी काही केल्या मनाला चैन पडत नाही. अँड इट्स ओके. आय थिंक हे नॉर्मलाइज करणं खूप गरजेचं आहे की सतत तुम्ही हसमुख आणि आनंदी आणि पॉझिटिव्ह नाही राहू शकत. देर शुड बी डेज वेन यू फील लाईक आय डोंट वॉन्ट टू डू एनिथिंग, मला काही करायचं नाहीये, आणि दॅट इज ऑल्सो ओके. तर तुमच्या स्वतःच्या हेल्थसाठी एक अशी बँक करा की कुठली आसनं मला सर्वात जास्त मदत करतात. मग हे आज काम नाही करत आहे, मग दुसरं ट्राय करा. दुसरं नाही काम करत आहे, तिसरं ट्राय करा. बट नेव्हर गिव्ह अप. आय थिंक योगा, व्हॉट योगा गेव मी was this ability to think, to trust my gut instinct a lot more. And I hope that this is the message that you got from my talk. Once again, thank you very much for having me. Um, I'm happy to take any questions. And I wanted to just leave you all with this quote from Gautam Buddha, which is that pain is inevitable. All of us inherently might come across someone with chronic pain, but suffering is not. So it's up to us how we deal with that. Thank you.